School Nursing, San Luis Obispo County Office of Education, Special Populations. SLOCOE welcomes Cuesta nursing students into our medically fragile classrooms. The purpose of this presentation is to give you an overview of the various nursing roles in school health, in particular serving students in special education. According to the National Association of school nursing is defined as a specialized practice of public health nursing which protects and promotes student health, facilitates normal development, and advances academic success. School nurses, grounded in ethical and evidence-based practice, are the leaders that bridge healthcare and education, provide care coordination, advocate for quality student-centered care, and collaborate to design systems that allow individuals and communities to develop their full potentials. Staff you typically find in a school health program include a school nurse, who most often oversees multiple sites and is considered itinerant, traveling from site to site. Registered nurses, licensed vocational nurses, and unlicensed assistive personnel, commonly with the title of health clerk, instructional or health aide. They may have certification as a nursing or medical assistant as well. The school nurse is the legally recognized school health authority. He or she functions as the clinical supervisor and holds a health services credential above a bachelor's degree. Many school nurses hold master's degrees in the areas of nursing, public health, and education. California Education Code is very specific about who can carry out health services in the school setting, only under the supervision of a physician or credentialed school nurse. According to California Education Code, the role of the school nurse includes implementing public health laws and monitoring compliance with immunizations and communicable disease guidelines, assessing, evaluating, and interpreting health and developmental status, designing and implementing health plans, connecting students and families to resources and services, coordinating care, and interpreting medical and nursing findings, and making recommendations accordingly. They also consult, conduct trainings, and serve as resource to staff on medical and health-related topics, assist parents and students to access health care, counsel students and parents by addressing health-related attendance problems, helping understand and adjust to physical, mental, and social challenges, explore attitudes, possible misinformation, and values which affect health behavior. All school districts have students eligible for a special education. The County Office of Education has some of the highest need students in our community and currently in our special ed programs, including those in our emotionally disturbed and deaf and hard of hearing programs. The Individuals with Disabilities Education Act, also known as IDEA, is a federal law ensuring special education services are provided to children with disabilities across the nation. Disability is a natural part of the human experience and in no way diminishes the right of individuals to participate in or contribute to society. Improving educational results for children with disabilities is an essential element of our national policy of ensuring equality of opportunity, full participation, independent living, and economic self-sufficiency for individuals with disabilities. The Individuals with Disabilities in Education Act ensures that all students with disabilities are eligible for a free and appropriate public education, also known as FAPE, in the least restrictive learning environment. Two categories of special education students are severely handicapped and medically fragile. Students that are severely handicapped have diagnoses of autism that are low functioning, Down syndrome, mental retardation, genetic disorders, and other developmental or physical disorders that affect learning. Medically fragile students have diagnoses of severe cerebral palsy, specific genetic disorders, birth defects, severe seizure disorders, severe mental retardation leading to developmental delays, and other medical conditions such as respiratory insufficiency. You will see students with many of these medically fragile conditions during your observation experience. Students eligible for special education are provided various services, such as adaptive equipment, assistive technology devices, related services like speech pathology, occupational therapy, vision impaired program assistants, deaf and hard of hearing program assistants, orthopedically impaired program assistants, and direct nursing services. The Individualized Education Plan is a written report that includes students' level of academic achievement, their annual goals, their short-term instructional objectives, also known as benchmarks, specific services that are to be provided, a description of their educational program, the duration of services, health issues that impact learning, and plans of care. Special education students with IEPs have a multidisciplinary team. This team includes the teacher, who has a specific credential and or license, a school administrator, a school psychologist, a school nurse, other support services such as occupational physical therapy, speech-language pathology, the parents, community support agencies such as California Children's Services or Tri-Counties Regional Center. After the initial assessment and team meeting, the IEP is reviewed annually and updated triennially by the team. SLOCOE utilizes registered nurses in our medically fragile classrooms. The role of the classroom nurse is to collaborate with the school nurse in the medical management of students, daily assessment of student health, implements medically ordered treatments and individualized healthcare plans, specialized healthcare procedures such as medication administration, gastrostomy and jejunostomy tube feedings, oral and trach suctioning, ventilator and tracheostomy management, oxygen administration and monitoring. The classroom nurse communicates with outside medical providers, works closely as a team member with the teacher and other non-licensed staff in the class, assists in providing health education to families, develops close and trusting relationships with students and families. The role of the school nurse in the medically fragile program includes developing the individualized healthcare plans, assessing staff's ability to learn and carry out healthcare plans, the annual staff trainings, monitoring and clinically evaluating both licensed and unlicensed staff. They function as an IEP team member, including providing initial, annual, and triennial health assessments. They conduct annual screenings, refer as appropriate, and follow up. They also function in the role of case manager and communicate and collaborate with families and care providers and serve as a mentor. Confidentiality in the school setting is very important, just as it is in any other area of health services. Two laws recognized in the school setting include FERPA, the Family Educational Rights and Privacy Act. This law allows for information to be shared on an as-need-to-know basis with other professionals within the school setting. HIPAA, one you should already be familiar with, the Health Information Portability and Accountability Act, must be followed anytime communication is necessary or records are requested from outside providers. Student expectations while observing in the medically fragile classrooms. Please be considerate of the classroom nurse's daily schedule and time constraints. Take time to review individualized healthcare plans and physician's orders that are in the designated binders. Review standard healthcare procedures that are from the state Green Book. Observe quietly as to not disrupt when learning is happening. Remember confidentiality. Wash your hands upon entering and leaving the classroom. And if you're sick, please do not come. You will notice that learning doesn't happen in a traditional sense in these classrooms. These are considered non-academic environments with the focus on functional mobility, communication, socialization, self-help skills within a sensory stimulating environment. Staff questions are welcomed at appropriate times, and please don't be afraid to interact with the students during non-instructional times. Always make the least dangerous assumption with what these students can hear and understand. A book I highly recommend reading is called Out of My Mind by Sharon Draper. This is a quick, easy read that gives you a glimpse into the life of a very bright little girl who cannot verbally communicate but understands everything and is one of the smartest kids in her class. It's very eye-opening and gives you a certain respect and appreciation for the students in these classrooms.